Hi, everybody. Patrick McKeown here. I'm in Costa Rica. It's at Blue Spirit Retreat, and we just had quite a very interesting conversation with our group of people today. It was all about rumination of the mind. You know, mankind, we have been looking to sort this one out for thousands of years, and yet we haven't managed to learn how to stop thinking or for many people, even to bring a stillness to the mind. Now, you could say, well, go do some meditation, go focusing on your breath, but we need to do more. And the whole aspect is that we can make a tremendous difference to our state of mind in terms of helping to bring a quietness to that mind. It's not just about focusing on the breath. We have to start with breathing in and out through the nose. There is a communication from the nose to the brain, and it does affect brain waves. It also influences the parts of the brain associated with rumination. We also, by breathing in and out through the nose, we have a better recruitment of the diaphragm, which in turn helps with bringing calmness to the mind. And nasal breathing, of course, helps to slow down the breath. When you breathe through your nose, you breathe slower. And slow breathing is very good at helping to induce relaxation. And I'm not just talking about slow breathing during a practice. I'm talking about using the nose, breathing in and out through it every minute, every hour, every day, because with that, you have slow breathing. When we think about telling the brain that we are safe, it's very important to slow down the speed of the exhale. And we also focused on that today. So we were talking about, whenever we get into a stressful situation, our breathing becomes faster and harder in upper chest. And of course, that feeds into stress. It's never just a difficult situation that changes our breathing pattern. It's also how do we breathe during that time and how do we breathe after that time. Now, can we use the breath to our advantage here? And the answer is yes. Don't hyperventilate. So it's like the podcast that I was listening to with Dr. Rangan Chatterjee and Dr. Rahul a number of years ago. Dr. Rahul is a brain surgeon, and he said when he gets into a tricky situation, the first thing he does is prevents himself from hyperventilating. Now you can imagine the responsibility and the stress involved of being a brain surgeon, and his tricky situation is a tricky situation. You can be sure of that. But he knows that the first thing he does is prevents himself from hyperventilating. He doesn't do anything else. The first thing, according to him, prevent himself from hyperventilating. If you're hearing noise in the background, there's actually monkeys around, and I'll kind of show you a glimpse of it in a moment, but the view out here is absolutely amazing. And of course, nature is very good at helping to bring a stillness to the mind. Anyway, coming back to reducing rumination, reducing overthinking, because of course, very often we are at the very mercy of the mind. We often don't take pause. We don't check in on what we are thinking about. We don't ask the question, is our thinking useful? Our thinking mind just goes on in the background, and yet it dictates our quality of life and often drives us into misery. It certainly ramps up stress. It can ramp up anxiety, and it can prevent us from really reaching our full potential. So I talked about breathing in and out through the nose, but how about improving blood flow to the brain? So I suggest you do a little bit of research on this in terms of breathing techniques. You know, if we want to increase blood flow to the brain, we have to think of the gas carbon dioxide. And also by thinking of the gas carbon dioxide, which we produce internally. So this gas we produce internally. It's a byproduct of our metabolism. And in order to increase carbon dioxide in the lungs and blood, all we have to do is just breathe a little bit less air at different times throughout the day. And with that, you have to improve blood flow to the brain. Now, bearing in mind that 20 to 25% of blood goes to the brain and 20% of the oxygen that comes into the body goes to the brain, doesn't it make sense that for optimal brain health, and with that, a quietness of the mind and the capacity to hold attention of what we're doing, that we should be giving it the fuel that we need? But very often we're not, because we may have had trauma in our life. Of course, we may have had high stress levels. We may be mouth breathing. We may have dysfunctional breathing, which is fairly common. And with that, our faster and harder breathing pattern, causing a lowering of carbon dioxide, not all the time, but it could be at different times throughout the day, in turn reduces blood flow to the brain. And the very time that we need to have clarity of mind to be able to make good decisions, we don't, because we're often going into that fight or flight response because of the stress induced. So, can you think straight when you're under pressure? And that's the measure of basically our ability to be able to get ourselves out of tricky situations, but we need to think of our physiology. Another aspect in terms of bringing quietness to the mind is the nervous system. So the nervous system, the autonomic nervous system, is the functioning of the body that happens outside of our voluntary control. We don't have to think about it. But when we think about the two main branches of the autonomic nervous system, we're thinking about the fight or flight response, or we're thinking about rest and digest. And, it's all the small little stresses that happen in our daily lives that they all accumulate. And we can be exposed to so many of them. And it's almost like the frog in the boiling water, that it catches up on us before we even know about it. And then it just might take one small stress to throw us over the edge. And then we're wondering, why did we react to that one small stress? We didn't just react to that one small stressful situation. It was an accumulation. It was the last stressful situation just kind of pushed us over a bit. So it's really important to tell the brain that we're safe and dampen the stress response. There's nothing beneficial from pushing ourselves through situations and pushing ourselves through stress and overriding the signals of the body, because the brain is telling us to keep going, keep going, keep going, keep going at the expense of what? Keep going at the expense of our health, keep going at the expense of our state of mind. Achievement. What achievement? There's no achievement there. And I know it's not easy because society drives us into achieving. And that's the way society is. It's good for society. But we have to be also thinking about ourselves and tell the brain that we are safe. Taking a soft breath in through the nose and a relaxed and slow, gentle breath out, and doing that at different times throughout the day. Physical exercise. If you do physical exercise with your mouth closed, you improve blood flow to the brain. That's a very simple way to do it. And when you do your physical exercise with your mouth closed, pay attention to your breathing. In other words, use your physical exercise not just as a training for the body, but a training for your breath, and more importantly, a training for the brain. So it's like everything else. We get good at what we practice. And if you're practicing distraction all day long, well, that's it. You're going to have a distracted mind. But if you gently bring your attention onto your breath at different times throughout the day, or bring your attention into the body, or bring your attention into present moment awareness, in the absence of analytical thought. So not looking through the thinking mind. When the thinking mind is subsided and you're connected with the breath in the absence of thought, that in turn you're helping to train the brain. And especially when the mind wanders, because minds will wander. But whenever you notice your mind wandering, bring your attention back onto your breathing. And every time that you bring your attention back onto your breath, you are training your brain to hold attention. Now, this isn't just helping your mental health, but it's actually going to contribute to improved productivity, if that's what you want. Well, it's like this. If you're doing something, you might as well do it with the best of your attention. You might as well do it with all of your attention, because then you will produce quality of work. Otherwise, you're just going through the motions. And what's the point in half doing something? And of course, it's very rewarding when you look back and you're after doing something really well. You've applied yourself, you've achieved what you can do. And in order to be able to get to that state, we need to think of the brain. Another factor that's involved, of course, with rumination is poor sleep quality. If you have poor sleep, or if you're waking up during the middle of the night, or maybe you have snoring or insomnia, or if you have sleep apnea, or if you have upper airway resistance syndrome, in other words, if your sleep quality is not good, if you're open mouth breathing during sleep and waking up with a dry mouth in the morning, it's very important to learn to breathe in and out through the nose during sleep. And of course, we have a product, it's called Myotape. It's a safe product for helping to bring the lips together during sleep. One of the most remarkable things that I did 24 years ago was actually more. I'm giving breathing training 24 years, but I came across breathing in the late 1990s, and I started taping my mouth closed. I used a nasal dilator because I don't have a good nose, by the shape of it anyway. One nostril is smaller than the other. So of course that doesn't help. So I used the nasal dilator to just gently flare open my nostrils, but I also closed my mouth. And I was waking up with the best night's sleep ever. So something that I'd never had for 20 years. And then all of a sudden waking up with the best night's sleep, waking up feeling refreshed with adequate energy throughout the day, and even more important, better mood. And I was often wondering, like, why on earth are people not talking about this? Why was my healthcare professional, my doctor that I was going to every 3 months with asthma, why was he not saying, Patrick, breathe in and out through the nose? Because when I had my mouth open, I had poor sleep. I also had rumination of the mind. I had difficulty focusing, difficulty concentrating. I'm not new. And there's many of you listening to me today in that same boat. So if you feel that you overthink, I will genuinely say that you can really, really make tremendous inroads with that and go gently with it. It's really just about taking into consideration all of the factors that contribute to an overthinking mind. You have to think about your breathing. How well do you breathe? You have to think about the nervous system. Can you dampen the stress response and increase relaxation by changing your breathing patterns? You have to think about improving your sleep quality. And those are the foundations. And then having your attention on the breath. Just simply paying attention to your breathing. The mind wanders, you bring your attention back, or bringing your attention into the body, or bringing your attention into everything that's going on around you. So when you're in a view with a view like this, which I will just show you. So this is Costa Rica. It's a Blue Spirit retreat, and it's an amazing center. And you can't really see the sea down there, but you might just get kind of a glimpse of it. And there's an eagle flying there again, but I'm not sure even if you'll pick up on the eagle. And there are monkeys about. Of course, anytime I have the camera on, monkeys disappear for some reason. But it's a really amazing place. And when we're in nature, you see that's actually an eagle there. It's a pretty big bird, but it doesn't look so big on camera. But anyway, getting ourselves into nature, just to give you a glimpse of where we are here in the background. So just thought I'd show you that because it's nice to, immerse ourselves in nice surroundings, but especially in nature. Nature is in stillness. It helps to bring the mind into stillness. Go gently on yourself. If the mind has a tendency to wander, that's what minds do. But, if you have a promise, or if you say to yourself, you know what, I'm going to give this a go. I'm going to go for a walk and I'm going to bring my attention onto my breath. Or I'm going to sit down and, even if I'm talking to somebody, I'm not going to be just stuck on my head all the time. So we spend 50% of our time stuck in our head. Human beings, 50% of the time we are on earth awake, we are stuck in our heads. And the more we are stuck in our head, the less we are connected with everything that's going on around us. How on earth can we appreciate life, connect with the people around us, if we're not even present with them? We need to see, we need to listen, we need to feel, we need to taste, we need to smell, we need to immerse ourselves in life. And the best thing of all is get out of our heads, because whatever's going on in the mind, very often it's negative, it's not particularly helpful, it's unproductive, and it's just the mind going around and round and round like a broken record. All the best from Costa Rica. Pay attention to your breath, but also think about how you breathe. So it's never just about the air coming in and out of the nose, but how are you breathing? How fast are you breathing? How hard you are breathing? And if you want the most simplest exercise to tell the brain that you're safe, simply take a soft breath in through your nose and a relaxed and a slow and a gentle breath out. Don't have to time it. Breathe relative to how you are breathing, and do that for 10 seconds, 15 seconds, 30 seconds, a minute, 2 minutes. Just taking the soft breath in through your nose and a relaxed and a slow and a gentle breath out. It's an amazing little exercise. There's nothing for anybody to see, but at the same time, you're going to bring a softness. You're telling the brain that you're safe. You're not going to be going into a state of hyperventilation. And hyperventilation just means faster and harder breathing. When we go into that stage, we don't make good decisions. If you want to stay composed and make good decisions under pressure, have control over your breathing. Okay, take care for now.